Welcome to another Autobrush Live. Today we have a very special guest, Dr. Katie Woehling.
Hi.
We're doing a really fun segment tonight, which we have done before, called Ask a Pediatric Dentist. So I've compiled a bunch of questions that our community has asked us over the last couple weeks for Dr. Katie. And if you're joining us here tonight, be sure to check out our chat below and ask your own questions because she's here and ready. She's like on call for you tonight to answer all your questions. And if you do comment in the chat, we'll be doing a timed giveaway. So the last comment when my randomized timer goes off will win free Autobrush kids flossers. So these are strawberry, like infused dental flossers, and they look like little giraffes. They can't get much better for that for the kiddos. But yeah, let's talk about Miss Dr. Katie Woehling. She's a super impressive. I was telling her backstage that her credentials are amazing. A little bit about her. She is a pediatric dentist in Philadelphia, Pennsylvania. She's currently in a private practice at Cobblestone Kids Pediatric Dentistry, and she's the director of the dental division of St. Edmund's Home for Children in Bryn Mawr. Is that right?
Yep.
Bryn Mawr. And also, if she didn't have enough on her plate, she practices part-time with Doc Bressler's Cavity Busters.
Yep.
She's a woman who does it all, and a mother.
Thank you.
Amazing.
Thank
Yeah,
you.
so do you want to add anything to that? Tell us a little bit more about yourself.
Sure. I am a pediatric dentist. I went to undergrad at Penn State, and then I continued my dental education at the University of Pennsylvania. And I continued on to do my residency at the Children's Hospital in Philadelphia. I have been in Philadelphia since. I have 3 little boys, and my husband and I feel so lucky to be raising them. But, having kids has definitely changed the way I practice pediatric dentistry. And I feel like it has, given me such perspective. So, if anyone's parents out there, you have any questions about your own children in terms of their dental health, I would be happy to answer any of that. So thank you so much for having me. I really appreciate it. And I look forward to hearing from you all.
Awesome. We actually have somebody from our Instagram asking a question right away. And they're asking, is it possible, this is from Lindsay Buckner, is it possible to reverse cavities in kids?
That is a great question. So the answer is it could be possible depending on the size of the cavity and the location where it is on the tooth. So one of the most helpful tools that pediatric dentists and dentists in general have to help strengthen the mineralization of a tooth is the use of fluoride. So we recommend using fluoride in a toothpaste for children, and then a mouthwash once they're old enough to swish and spit, and then getting a fluoride application when you actually come into the dental office once every 6 months. And fluoride is an element, and it's an element that actually incorporates itself into the outer surface of the tooth structure called the enamel, and it creates something called fluorapatite. And fluorapatite, not to get too biochemical on everybody here, but basically is stronger than the hydroxyapatite, which is there normally, which makes it more resistant to the acids that are in your mouth when you eat sugary foods and are starting the process of digestion. And it can actually, if there is a small area of a cavity, we call that an incipient lesion, meaning that it's just in the outer surface of the tooth, it can actually help to remineralize that area and just like you had asked, basically reverse that cavity. However, once a cavity goes deeper into the surface of the tooth, the likelihood that fluoride would be able to penetrate that area of the tooth as deeply that it would needed to reverse the cavity completely is less likely. It could help stop the cavity from growing larger, but it wouldn't reverse it at that point. And that's why traditional restorations like fillings and crowns and everything are still recommended for kids. There's also a product called silver diamine fluoride, which is a high strength fluoride, basically a high strength fluoride in a liquid that you can apply to a tooth that has a cavity. And the fluoride helps to, again, remineralize the tooth surface. And the silver that is in silver diamine fluoride actually helps to, as an antimicrobial, so that the cavity doesn't grow bigger. So that's another way that you can help to arrest a cavity, make it stop growing, and basically buy some time until you either tooth falls out if it's a baby tooth, or you can get further treatment, or you just monitor it closely with your pediatric dentist in order to have the most appropriate treatment plan going forward. So that long-winded answer is yes, in some cases you can.
Kendra is asking us here as well. Do you see mineralization happening through the use of coconut oil pulling?
Good question. So I personally, as a pediatric dentist, do not, I do not have any experience with oil pulling. It is not something that is well documented in the American Academy of Board of Pediatric Dentistry's literature. Fluoride definitely takes the main stance there, as well as any sort of thing that has any sort of like hydroxyapatite component to it. There's also other ingredients in certain toothpastes that help to help with remineralization as well. So to my knowledge, and what I suggest to my patients is that coconut oil pulling is not probably the most efficient way to do that.
Is that along the same thoughts of the new like nano hydroxyapatite?
Yep, exactly. Yeah. So that's the hydroxyapatite toothpaste that they use, and there's also that can be in variety of toothpaste as well, which helps because there's definitely you have to. It is helpful if children can spit out toothpaste when they're, when we're talking about fluoride toothpaste. And so that's a good alternative too. But again, the most studied thing that we have so far is that the use of fluoride is our biggest thing in our toolbox right now. But definitely in terms of the hydroxyapatite, like toothpaste are going in that direction and everything too. So I feel like that will be something that we would see a lot in the future as well.
Awesome.
Yeah.
We have lots of questions coming in for you.
Sure.
What are your thoughts on silver diamond fluoride for non-invasive pediatric treatment?
So that's what I talked about in the basically the first part of when I was speaking about fluoride. That's the silver diamine fluoride. And we use that in non-invasive pediatric treatments a lot for our patients. We use it commonly for teeth that have an incipient lesion. If you would like to try to reverse it or at least try to arrest the decay. We also use it for a lot of kids that are unable to, are pre-cooperative and are unable to sit in the chair for treatment. This is kind of an easier way to provide treatment in the meantime until they can get to the stage where they can sit in the chair or get to an operating room for treatment. So yes, we absolutely use it all the time for non-invasive pediatric treatments. And it's with the right application schedule and with the right application strategies, it can be very effective as long as you're using it on the right tooth and the right patient, because there's definitely suggestions on how to use it and how to select the correct patients.
Thank you for that. Yeah. One of our most common parent questions is, you mentioned using fluoride with kids. Is there an age where you should start? Because there's concern around the toxicity of it.
Yes, of course. So like everything in life, you do have to know the exact, the amount of the dosage of fluoride to take in order for it to be safe and effective. So the American Board of Pediatric Dentistry says that children can start using a fluoride toothpaste as soon as their first tooth erupts. However, the amount that you use is critical. So from the ages of 0 to 3, you should just be using a small rice size amount. So a teeny tiny little smear of fluoride toothpaste, almost to the point where you can't even see it on the toothbrush. And that amount is safe to swallow morning and nighttime. And then over the age of 3, between 3 and 6, you can increase the size of the fluoride toothpaste to about a pea-sized amount. And again, even adults should really only be using about that much toothpaste as well. So the amount of toothpaste that you use is critical to make sure that you're not, obtaining too much toothpaste when you're swallowing it. And again, fluoride is also found in many communities' water source. So that's another place that you would be getting it.
Awesome. All right, along the same lines, you mentioned using fluoride right in the beginning of that tooth eruption, but does tooth care start before then?
Great idea. So yes, children are born with obviously tongues and gums and jaws, and we have to keep those healthy as well from the beginning. So what I always suggest for parents to do is that even to just get kids used to having something in their mouth in terms of like a little washcloth with a little bit of water on it and just kind of rubbing the gum tissue, or a very soft bristle, even like a little bit of like one of those foam like toothbrushes or something, just to kind of get the kids used to starting a dental routine. And again, it's more critical obviously when they have teeth, but absolutely you can wipe the gums after nursing or bottle feeding before the child has teeth is wonderful and a great way to get kids used to the routine.
That was a selfish question there because the community that knows and has been with our lives, I'm having a
No, that's
baby here,
perfect. Yeah.
here soon. So
No
thank
worries.
you. We have some more questions along the lines of toddler teeth. There's a lot of
Yeah.
new things happening, eruptions, but also we have the bottle that plays a factor as well as binkies. So one of our questions here on our Instagram is, how do you recommend children to stop using a binky or thumb sucking?
That is a great question as well. So, our guidelines state that children should stop non nutritive sucking habits, which would be binky, pacifier, and thumb, or any sort of fingers, by the age of 3 years old. And they see that basically the anterior teeth, the front teeth on top, tend to flare forward a little bit if a child uses a pacifier or a thumb for long durations throughout the day or night. And that, we call it an anterior protrusion of the teeth. That can and tends to reverse itself if you stop it by the age of 3. So our most helpful techniques in order to have children attempt to stop these habits are to basically use positive reinforcement. So the most helpful thing that I've heard from parents is to, especially with the pacifier, because the pacifier tends to be a little bit easier because it's an actual physical item that you can take away from a child versus a thumb is obviously attached to their body. So we have the children kind of pick with the parents when everybody feels that it is time. A lot of people use like a birthday or some sort of date in their mind where they're going to give the pacifier to the pacifier fairy. They're going to give it to the babies. So at our office, we actually have a mailbox, and this mailbox, the kids get to see it from day one of them coming to our office. And this could be when they were 1 year old, and we would just show them, we let them play with it. And then once they become older and we want to start trying to talk about giving the pacifier away, we basically say that the pacifier fairy comes to our office at nighttime. And so they can pick a day to bring their pacifier back to our office. They put it in the mailbox. Sometimes it's like an entire bag of pacifiers that they bring. And then our office has like little gold coins where kids get to buy presents at the toy machine. So we use that positive reinforcement as a way to get them to this understanding of basically giving away their pacifiers one day. Other alternatives, people have put it in, gone to Build-A-Bear and you put it in a stuffed animal so they still get to hold it tight. Also, the Wubbanubs with the little animals attached to them, they'll cut off the pacifier but still use the animals as like a security blanket, a little toy to hold. But most parents say that after about 3 nights of not having the pacifier, the sleeping tends to go back to the way it was. And that's kind of the most common thing, is to go cold turkey kind of. However, there are people that say, you can poke a hole in it so it doesn't have the good like suction mechanism anymore. You can cut the top off of it and make it shorter as you go. Sometimes those concern me a little bit because I get worried about the plastic fraying, especially because a lot of kids bite and chew on their pacifiers, and now we've just created an area of weakness in the plastic. So that worries me a little bit in terms of a choking hazard. So I personally don't recommend that to my patients. I try to do this, let's pick a day and let's stick to it. And I try to do it on a day, and a schedule that works for the family. I try to suggest not within 6 months of a big adjustment, like a new member of the family, a move, a start to school. So I try to say, make it so you set your kids up for success that way. The thumb is harder. The thumb requires a definite level of cooperation from the child to stop a thumb habit. There's a product called Mavala Stop, which you can paint on their thumbnail, which is kind of like a sour tasting nail polish. And that basically helps to deter the child from sucking their thumb. There's thumb guards, which are these little plastic coatings. They're little like shields that you put on the thumb so that they can't actually suck their thumb. Gloves sometimes work with the thumb, but there's definitely a level of internal motivation that needs to be there with a child that sucks their thumb that doesn't necessarily need to be there with the pacifier, because they need to kind of understand that there is a need to stop, there's a want to stop, and kind of be on board with it too. So we see thumb sucking lasting more frequently older than 3 years old. And we definitely see thumb sucking continue further than that. And then it ends up that they get sent to the orthodontist while they're still sucking their thumb, and they have an appliance in their mouth at some point that actually stops the thumb sucking habit. So that one's a little bit more tricky, but there's definitely ways to stop that too.
I didn't know that they had appliances for that.
They do. Yes, they do. And they're also just other orthodontic appliances that you really couldn't like get your thumb in the mouth anyway while it's in your mouth. So it's not specifically for thumb sucking, but it would do the same thing. So
very, very interesting. All right. I just want to remind people in the comments right now, like, thank you so much for commenting. Our giveaway first winner is coming up here very soon. I'm sorry if you can hear my airplane going over my house. So if you want to be in the running to win some kid strawberry flossers that are super cute, they look like little giraffes, then keep on chatting away. Well, one thing I love about these is that my daughter and I, she doesn't really like flossing. She's 3, almost 4.
yes.
So it's kind of a harder thing, but we pretend that the giraffe is eating leaves in between her teeth, and like that game has helped.
That's a good one. I like that.
So that was my little thing. We have much more comments to go through. Let's see. One of the questions from Kendra is, could the Otterbrush be good used on gums only before teeth erupt? I'm not sure if you know this, Dr. Katie, but we have a teether. It's an elephant teether.
Oh,
so
cool.
It's not meant to like clean teeth, but it's like a baby, no normal elephant teether. Let me see if I can actually grab it. I'm not sure where I put it, but it's just a little teether.
Okay.
But I would take Dr. Katie's advice of cleaning the gums with like a washcloth, right? Or like.
Yeah, I mean, I would have to, I'm going to defer to you guys on that one in terms of how Autobrush is like the intended use for it. I don't know if that would be too like abrasive on the gums before teeth are present, but there's also a product like those little, they're called like spiffies. They're like little wipes for your teeth, which you could use on the gums as well. But I generally just recommend like a washcloth, but I'm I will defer to you on that one in terms of what the intended use for that was.
Yeah. So I think her question was just saying, like, cut. Oh, my timer went off. That's my duck. Let's see. I'm going to refer to our last comment, which is Kendra on our Instagram. So you've won our flossers. We'll DM you and get those to you sent to right away. I think what you were saying is that if it could just be used on gums, our Autobrush brush doesn't start until 3 to 5 range, but our teether is just like a normal, like the banana teether or like a soft silicone teether. Not meant to clean, just for
Yeah,
teething.
I would agree with that. I feel like the bristles might be like a little bit, and it's also really hard to get in like an infant's mouth with something that big, I would think.
Yeah. No, I wouldn't recommend doing that.
Yeah. Seems like it would be a bit invasive.
Yeah. All right. Another comment for you. So, if a baby tooth is lost too soon, do you need to get a spacer?
That's a great question as well. And the answer again is it depends. So the sequence of when you lose baby teeth can range from anywhere, we're talking about the posterior teeth here, the back teeth. If a child loses a front tooth early, in general, the canines, the pointy teeth in the front, tend to kind of be roadblocks and barricades and prevent teeth from shifting from the back forward. So you do not need a spacer in front teeth. However, if you lose a back baby tooth early, it depends on when you lose it. If your 6-year molars, your adult teeth, are present in the mouth, then and you lose one of your first baby molars, then it tends to not shift that much space. However, if you lose one of the second baby molars that are right next to that big adult tooth, then we do recommend spacers for that. However, kids all have different amounts of crowding and space loss, and sometimes we even recommend spacers when they haven't lost a tooth, just to kind of try to hold space and make a little more room in their mouth anyway. So the answer to that is a little bit complex, and it depends on the stage of development of the child, their actual jaw structure and how crowded they are, when the tooth was lost, and what tooth was lost. So I would love to give you the really short answer, but it would get very technical. So it depends.
Perfect. All right, let's see. A question from Chris is what are the top 3 common mistakes you see, and how can a parent prevent them? I guess with tooth cleaning.
Yeah, no, this is a great question. So I think one of the top mistakes that I see involves diet. So diet is a very controllable factor in the presence of tooth decay, because if bacteria don't have the sugar to live off of, they are not going to replicate and create cavities. So giving a child juice throughout the day, juice, Gatorade, soda, anything that basically has added sugar to it, is going to greatly increase your risk of cavities. So I generally tell my patients that water is what they should have in their water bottle all day long. They can have milk with a meal, but I tend to even say, water is really what I love for teeth. And then just make sure that the last thing that you do before bed is brush teeth, and there's no milk or breast milk or anything after that. And so I would say giving a child juice would be one of them, one of the top mistakes. And then the other thing is gummy snacks, and included in that are gummy vitamins. Gummy vitamins, if you walk into any, CVS, any pharmacy or any big store, all of the vitamins are gummy now, essentially. And gummy vitamins have sugar in them, and they tend to get wedged between the back teeth and in the grooves of the back molars. And we do see increased risk of cavities in kids that take gummy vitamins. So although you might think you're doing a wonderful thing for your child and giving them like a melatonin gummy or something like that, it really can be harmful for the teeth. So we always recommend the chalky vitamins, like when we were kids, the Flintstones ones, or Rainbow Light makes a chalky vitamin as well. But we always just say try to do chalky chalky vitamins versus gummy vitamins. And then the third thing, and I would say one of the most common mistakes, is that giving your kids the autonomy to brush too early. And really the age when kids have enough manual dexterity to be able to brush on their own is much later than parents think. So it's really when they're able to tie their shoes really effectively on their own. And for most kids, that could even be like 8 or 9 years old. So I tell my patients to have supervised brushing until they're 8 years of age, but really it's kind of up to the parent to look into the mouth at nighttime and see, is there plaque on their teeth? Is there like that little white film? Do their gums look puffy and bleeding and red? And make sure that that you are participating in the oral hygiene routine for long enough and longer than you would ever think. So I do see an increase in cavities once kids can start brushing on their own. So that would be the other mistake that I see.
Awesome. And can you talk more about that technique needed to brush? I know you said that they need to tie their shoe, but what also as a parent should you be looking for when they brush their teeth?
Yeah. So basically the Academy of the ADA recommends, it's called the modified Bass technique. And it's basically when a toothbrush is at like a 45-degree angle to the tooth and to the gums. And it's small circles that you're using to go kind of around each tooth on the, every single side of the tooth. So I will say with kids, and it is hard to do anything. So I am basically just so thankful if parents are able to kind of lay their children down and get a good look in their mouth in terms of just kind of brushing right where the pink gums meet the white tooth. Ideally, it would be for 2 minutes. I think that that's a really long time for kids to have any sort of attention span for brushing. And I don't pretend to think that that's a very realistic goal. So I always just say try to sing a song and try to get to the end of the song. And, even a round of Wheels on the Bus or ABCs. And eventually as they get older, you'll be able to do it for longer. And when you introduce things like the Otterbrush or any sort of electric toothbrush that has a timer involved, that definitely helps too. But again, it's just morning and nighttime brushing, last thing you do before bed, making sure a parent is helping, and try to just go in small circles where the tooth hits the gum. For as long as you can, up to 2 minutes of brushing. But in our house, we're very lucky if we get through one of our songs.
Yeah. Along that same note, I want to ask you, so we just came out with our standard Autobrush. How can this be a helpful tool to for kids and parents to brush together?
Yeah. So the way that I see Autobrush as being a helpful tool is that I believe that it can help kids get excited to brush. It is a fun, colorful, appliance that looks like an animal, which is cool. And I feel like it helps intrigue kids and to get their interest. So I like it as a beginning tool. And then as a parent, then you might have more of the cooperation from your child to get into their mouth with, a toothbrush or an electric toothbrush, one of the, spin brushes, to get in there to brush if needed as well. So I feel like it definitely helps, spark kids' attention to get to the brushing that they need to be getting to. And it also starts to just teach them about the brushing routine. It helps to foster that autonomy and get them interested. And then I also think that it helps with just desensitization in general, in terms of the feeling of something, touching your cheeks and your lips and your gum and your tongue and being inside of your mouth. So for a kiddo that's struggling kind of at the dentist with a feeling of gagging or just not liking loud, noises or sounds or anything like that, this might be a good way to kind of help mimic some of the feelings that would be happening to their teeth at the dentist, but at home. So you can kind of use that as a desensitization technique as well.
I love that. Yeah. I feel like that's one of the biggest things with kids too, is dental anxiety.
Yes.
Not knowing what's going to happen or getting there and then feeling scared. Right. Do you have tips there to help prep a child to go see the dentist?
Sure. And I mean, we get it, right? Like the dentist can be a really
Yeah.
terrifying place. And it's one of those things where it's like, as a kid, you walk in and there's like loud sounds and smells and different sights and it's new. And so I feel like meeting the child to, their level and kind of acknowledging like it's okay, like come in and see our office. And we like to we use a technique called tell, show, do, which basically is we bring the children and their parents back into the exam rooms and we have them sit in the chair and we so at first I'll show them the mirror per se and then I'll say, let's count your fingers. Did you bring your fingers today? And so we count fingers and then we, hold it up to our cheeks to see if it's soft. Then we count our teeth and then I'll hold the actual spin toothbrush that we use to do the cleaning. We do it on our fingers first. We do it on their stuffed animals so that we make sure that we're telling them what we're doing. We're showing them what we're doing before we actually do it. And so that method really has helped a lot for us. And then honestly, the frequency of cleaning. So it's important to come to a dentist every 6 months. And while that is extremely important for the actual cleaning purposes, it's actually could be even equally or if not more important to just be able to get the feeling of trust, instilled with the dentist and your child. So it allows them to understand what the office is like and what to expect there and to learn to learn exactly what to expect at the dentist. And you'll see from the difference from like day 1 to, visit like 4 or something can be so drastic. And that's why I love what I do, because you can get a really nervous and anxious child to then feel so comfortable at the dentist. And that's truly so, so important. And that's the whole purpose of pediatric dentistry in general. So yeah, that's what we do.
Yeah. I love
But there's
I love
also
my
like books and,
yeah.
Daniel Tiger has a great one.
Yes.
Daniel Tiger visits the dentist. Elmo has good books. So I try to have parents do the prep work as much as they can too. Sesame Street has a good episode about the dentist. So there's a ton of, shows that have great episodes about dentistry now. So that helps too.
Yeah. I was going to add that with Daniel Tiger. That's what I
Yeah.
got my daughter.
It's so good, isn't it?
Yeah, she was so nervous to go.
Yeah.
And then now we were going to the doctor, like the actual doctor, and she's like, I don't
Yeah.
want to go. Can I go to the dentist? And I was like, it's a kind of a win for me.
Yes.
Like
That's a huge win. That's amazing. Yeah. Yeah. We like that episode too.
Yeah.
So.
All right. We have another question here from Tim. He asked, what's your opinion on tongue tie correction? When should a parent explore this as an option and why?
Oh, that's a great question as well. So basically, I don't know if anyone has heard of this, but basically there are a studies that have shown that infants that have a strong attachment from the floor of their mouth to a certain part of their tongue can have limited elevation and protrusion of their tongue, which can help with or can hinder, feeding initially, especially if infants are nursing. And so a lot of the time, babies will be referred to lactation consultants and pediatricians for difficulty gaining weight, difficulty latching, reflux or gas from swallowing a lot of air from not having a great latch. And many people feel that one of the ways that you could try to help with the infant feeding is by doing something called a frenectomy, which is basically trying to relieve part of that tongue attachment to the floor of the mouth. And the studies have shown that especially with anterior tongue ties, doing frenectomies has helped with nursing and feeding in moms and babies, as well as bottle feeding. And then also for orthodontics down the road, it can help with kind of shaping the roof of the mouth and also the like airway and breathing. So there's many things that kind of help in that regard too. So it's important to be evaluated and it can definitely help down the road. So yeah, in the right cases, it can help. I don't think I can hear you right now.
I was muted. I'm
There
sorry.
you go. No worries. Okay, what did you say?
Sorry about that. I was saying, if you see me looking this way, it's because I'm reading all the comments.
That's okay. That's okay.
But we have another question from you, from Trevin. He's asking, what's the best age for a kid to start seeing their orthodontist?
Oh, that's a great question. So we send our children to the orthodontist early these days. And I love getting kids evaluated early at the orthodontist anywhere between like 6 to 8 years old. But basically, it allows children to have a connection with the orthodontist to evaluate growth potential over the years and make sure that they are set up for the most success that they can have in terms of using any sort of appliance or any sort of early intervention that could help the orthodontist be able to have a more favorable outcome as the child grows. So we send our kids really early to orthodontists these days, and it definitely helps with kind of a phase 1 treatment approach where parents can meet the orthodontist, start to develop that relationship and trust, and it helps to create that lifelong bond between the two of them, which is great.
Yeah, my pediatric dentist told me that I will be going very soon to with my daughter because her teeth are so close that they're like,
Crowded. Yeah.
yeah,
Just
they're
make
like,
sure you floss. Flossing, when teeth touch in the mouth, it's extremely important to floss. It's kind of your best tool in your toolkit as a parent to just make sure that you don't get cavities between the teeth. And then, yes, it definitely is something that early intervention from an orthodontist can be so helpful.
yeah, awesome. Another one from Tim. He's asking, what is the best thing to do if a kid has a tooth that has fallen out due to trauma? And before you answer, sorry,
Yeah,
I
that's
just want to
okay.
remind everyone we have one more giveaway, so keep the comments coming, and that will be coming up fairly shortly as well. So off to you, Dr. Katie.
So it depends on if it is a baby tooth or an adult tooth. So if the tooth is fallen out, if the tooth that is fallen out is a baby tooth, a primary tooth, you do not implant it. You do not put it back in. However, if it is like your adult front tooth, the best immediate treatment is to actually put the tooth back in the mouth and then go to either a dentist immediately or to an emergency room. So it depends, again, is if it is a baby tooth or an adult tooth. But with baby teeth, you do not put those back in. We're going to give them to the tooth fairy that night. So that does not get reimplanted.
Awesome. I have a question here from Instagram asking, are there preventative measures I can take to lessen the risk of my child getting braces?
Getting braces. Oh, that's a great question. So I would say that the most controllable thing that in terms of genetics, first of all, plays a huge component into the size of a child's jaw structure and the size of their teeth. And that is uncontrollable. But the thing that we can control is the non-nutritive sucking habits that we talked about. So how long kids are taking a pacifier, having using a thumb, having a bottle, because all of that kind of narrows that top jaw and definitely can create issues with that going forward. The other component of that is also if kids are mouth breathing, if their tongue is protruded. And so there's many areas like myofunctional therapists, there are occupational therapists and PTs that help kids with that. And also, tongue tie revisions can help with that a lot too. So those are a few things that people are starting to look into. But I would say the number one thing that parents can really do is to help with the need for braces is the habits. And then also, if any child has a tooth that is taken out early before it should naturally fall out on its own, would be to make sure that you get the right space maintenance to kind of hold the jaw and the teeth where it should be until that adult tooth would come in.
Awesome. Sorry to cut you off with my
The
duck.
duck is hilarious. No, you're not at all. It's totally fine.
The last comment here is for Lisa. Congratulations, you've won our kid flossers. If you missed it, I like to pretend we're getting leaves out with these giraffe flossers as we're flossing my kiddo's teeth. She's also 3, and we'll send you those right away and also answer your question now that you're here. Dr. Katie, Lisa's asking, not sure if you answered this, but what are the tips you have for a 3-year-old who doesn't like to brush his teeth?
Oh, that's like every 3-year-old. It's so hard. It's such a tough age because they really want to be independent. So my biggest brushing suggestions are to try a fun toothbrush, one that like either lights up, plays music, and I always try to use 2 toothbrushes. So I have one, and my boys have one that they hold in their hand as well, so that you don't have to kind of fight over that toothbrush. So that helps a little bit with the autonomy struggle. Then we sing a song when we do it. I lay them down on their beds, and I kind of stand above them looking down at their head. That kind of helps relax the muscles of the face and kind of allows them to be a little bit more relaxed. And then if that's all not working, I definitely get a hand holder, and I have someone there at night, just to kind of help hold hands while I do it really quick. The other thing is Daniel Tiger does make a dental show. And so sometimes I will like put it on an iPad and they get to watch that for a second while we brush teeth. So, and then if I am alone and they are really squirmy that night, the other thing I kind of do is just kind of give them a little like hug where I can put my arms around their arms and I lay their head back kind of, in my arm. And I just kind of do it as quickly as I can. But I will say I do feel it is important, even though cooperation can be limited, to get the teeth brushing done in the nighttime. And then in the morning time, kids can be a little bit more independent with their brushing, but parents or supervisors or caretakers really need to be involved at nighttime. So that's the one where I say, it's okay to give a little hug and just kind of do it really quickly and just make sure we're getting in there. It's kind of one of those lists of like brushing teeth, cutting your fingernails, taking a bath, changing your diaper are all things that kids hate, but we just, have to do it. So, 2 toothbrushes, any sort of TV show, and having a helper are my biggest suggestions.
Awesome. I love what Kendra says that she started brushing. We have a Daniel Tiger toothbrush as well.
Yes.
And it sings the song from like Daniel Tiger. And
Nice.
She said that like changed it for her kiddo. Yeah. Awesome.
I also saw someone ask something about like if you could put the adult tooth in milk. Yes, that is definitely the second line of defense. If you don't feel comfortable implanting the tooth back into the mouth, you can put it in something called Hank's Best solution, which is like has the same pH as saliva, or you can put it in a glass of milk too and go to the dentist. But the first priority, I mean, if you feel comfortable doing it, would be to put the tooth back in the mouth.
Oh, yeah, with tooth loss and trauma, right?
Yes, I saw that in there somewhere. I just wanted to comment on that, so I didn't leave them hanging.
Yeah, perfect.
But yes, you could put it in milk. That is accurate.
Awesome. All right, let's see. So I have a couple more for like at the dentist when the kid is at the dentist.
Yeah.
Do cavities really need to be filled in primary teeth? So those first teeth that the kiddos get.
Yeah. So that's a great question, and it leads directly to a lot of people's questions about like orthodontics and everything like that. So in order to keep teeth in your mouth as space holders for the adult teeth, it's important that they're healthy and that they don't become infected or abscessed, because we've definitely have kids that have cavities that are large enough that they have something called facial cellulitis, which is basically swelling of the tissues that surround the face, the eye, the lower jaw, which can restrict your airway. So yes, and kids can be in pain and they miss school and they can't eat and they can't communicate. They're uncomfortable. They can have a fever. It can be really dangerous. So cavities in baby teeth can spread more quickly than in adult teeth, and can grow larger more quickly than in adult teeth as well. So having the proper follow-up from a pediatric dentist is really important, especially if you have like the tiny starts to a cavity that you're monitoring, which I'm all for that in terms of, allowing, being conservative with your approach to dentistry for sure. And I love when we're kind of watching and seeing how something kind of is turning out. But an important component of that is just making sure that you're really going to your routine care visits, so that a cavity doesn't get large enough that you're causing an infection, and children, miss school, can't sleep, and it can become a real emergency.
Awesome. All right. So we're coming to the end. We have one more question for you, unless anybody in the comments wants to hurry and type in theirs. But the last one I have for you is, could you run us through a mock exam? So say somebody hasn't taken their kiddo yet to the dentist. What would that look like? What should they expect?
Sure. So we recommend, the American Academy of Pediatric Dentistry recommends that children go to their first dental visit um, either within 6 months of getting their first tooth, or at least by the age of 1. And basically, finding a dental home is more than just coming in and checking for cavities. It's also a place where you can go if you have a trauma. So coming to the dentist before you have that initial trauma is important, because then your child knows where they're going. It's not an emergency situation where you're going to meet the dentist for the first time. So it definitely just helps in those regards to just make a child more comfortable at the dentist. So let's say we have an 18-month-old who's coming to the dentist for a visit. What we would do, in general, we would do something called a lap exam, which is where the baby is sitting in the caregiver's lap, and we would show them the mirror, like we said before. We would count teeth. Then we would clean the teeth with our little spin toothbrush. And then with the caregiver parent's permission, we would apply fluoride varnish, which is basically a high-strength fluoride sticky substance that can be applied to the teeth at the routine dental visits to kind of help reduce the risk of cavities. You can eat and drink right away, just nothing too hot or too crunchy with the fluoride varnish after, and you don't have to sit there for a few minutes like we had to do when we were younger. So that's the general routine for a kiddo that young. And then around 4 years old, or anytime that those back teeth start to touch where I can't see what's going on between the teeth, we would, after a clinical exam, we would take x-rays of the children's teeth, and that would help us evaluate the health of the teeth between the teeth for cavities. And yeah, that's what we would do going forward.
Awesome. Thank you so much.
Yeah,
and
of
thank
course.
you for joining us tonight. It's been so fun to
Yeah.
have you.
Oh my gosh, no, it was great. Thank you so much.
Yeah, I say to everybody, like on our Facebook group, that you're like our favorite pediatric dentist.
Thank you.
So thank you, Dr. Katie Woehling. If you guys have any questions going forward, we'll just drop them in the chat, and we'll try to reach out to Katie or our other pediatric dentist to get an answer for you. But in the meantime, we do have a coupon code for tryautobrush.com. It's going to be TOT10, so TOT 10, for 10% off site-wide. Any products. If you didn't get the flossers tonight, or you want to try a fun brushing brush to get your kid excited about toothbrushing, you can go shop there until the end of the week. But yeah, thank you again, Katie.
Perfect. Yeah, thank you guys for having me. I really appreciate it.
Yes, and we're going to try to get her back. I'm going to try to rope her back for another one of these. So
I would be happy to.
All right. Well, good night, everybody.
All right. Good night, you guys. Thank you.